The city of Kansas City is facing a worrisome public health crisis. An outbreak of tuberculosis, or TB, has gripped the region. As of January 31st, 2025, there are 67 active cases of TB. These cases require immediate and sustained medical attention. Treatment protocols involve a strict regimen of antibiotics administered under close supervision, often for several months. Adding to the concern, 79 individuals have been diagnosed with latent TB. While this form of the disease is not contagious and presents no symptoms, it has the potential to become active. This possibility underscores the seriousness of the situation. Tragically, 2 lives have already been lost to this preventable disease. The outbreak is concentrated in Wyandotte County, Kansas City, Kansas. However, it has begun to reach across the state line. Cases have been reported in Johnson County, a more affluent area. This spread highlights the ease with which airborne diseases like TB can transcend geographic and socioeconomic boundaries. The current outbreak is alarming. It far surpasses the dozen or so cases typically expected in the region. Health officials are working diligently to understand the origins of this outbreak. Contact tracing efforts are underway, and free testing is being offered to the public. Despite the airborne nature of TB, Kansas health officials have been downplaying the potential threat. This approach raises concerns about transparency and the urgency of the situation. The Kansas City outbreak is a stark reminder of a larger problem. Tuberculosis, once considered a disease of the past, is making a comeback in the United States. In 2023, there were 9,633 active TB cases reported nationwide. This represents an incidence rate of 2.9 cases per 100,000 people. This figure marks a 15.6% increase from 2022 and an 8.3% increase from 2019. The geographical distribution of TB cases varies across the country. California reported the highest number of cases in 2023, with 2,133. However, Alaska had the highest per capita rate with 10.6 cases per 100,000 people. These statistics emphasize that TB is not confined to densely populated urban areas. It poses a threat to communities across the nation. The recent surge in TB cases is particularly concerning. The 2023 increase is the largest since the start of the COVID-19 pandemic. While initially thought to be the largest U.S. outbreak since 1950, the Kansas City outbreak is not an isolated incident. The Centers for Disease Control and Prevention, or CDC, clarified that a larger outbreak occurred in Georgia from 2015 to 2017. This outbreak involved over 170 active and 400 latent cases among the homeless population. This historical context emphasizes the vulnerability of marginalized communities to TB outbreaks. Tuberculosis is not just an American problem, it is a global health crisis. In 2023, TB regained its grim title as the leading cause of death worldwide from a single infectious agent. This distinction had been held by COVID-19 for the previous 3 years. The statistics are staggering. Over 1.25 million people succumbed to TB in 2023. This figure includes 161,000 individuals who were co-infected with HIV. The global burden of TB is immense. An estimated 10.8 million people were living with active TB in 2023. This number represents an increase from 10 million in 2020, indicating a concerning upward trend. Access to treatment remains a significant challenge. Only 40% of individuals with drug-resistant TB, a more difficult to treat form of the disease, receive the necessary medical care. Addressing the global TB epidemic requires a multifaceted approach. The World Health Organization, or WHO, estimates that $22 billion is needed annually for comprehensive TB prevention, diagnosis, and treatment programs. However, the current global political climate threatens this funding. Austerity, measures, and shifting priorities could have devastating consequences for TB control efforts. Tuberculosis is not just a medical condition. It is deeply intertwined with social and economic factors. Poverty, homelessness, and overcrowding create conditions that are ripe for the spread of TB. Homelessness, in particular, is a major risk factor. Individuals experiencing homelessness are 10 times more likely to contract TB than those with stable housing. The link between poverty and TB is undeniable. Homelessness in the United States reached a record high of 653,104 individuals in 2023, a 12% increase from 2022. This increase is driven by a confluence of factors, including rising housing costs, the end of COVID-era assistance programs, and limited access to affordable health care. The concentration of TB in marginalized communities is a stark reminder of the social determinants of health. Factors such as malnutrition, limited access to health care, and exposure to other infections weaken the immune system, making individuals more susceptible to TB. Addressing the root causes of poverty and inequality is essential to breaking the cycle of TB transmission. Section 5, the COVID connection. The COVID-19 pandemic has had far-reaching consequences, potentially exacerbating the global TB epidemic. Emerging research suggests a possible link between COVID-19 infection and an increased susceptibility to TB. A 2023 study found that individuals who had recovered from COVID-19 were at a higher risk of developing active TB, even if they had no prior history of the disease. This increased risk is thought to be due to the impact of COVID-19 on the immune system. The virus can suppress immune responses, making it more difficult for the body to fight off TB infection. This potential connection between COVID-19 and TB adds another layer of complexity to the fight against both diseases. Section 6, funding cuts in public health. The resurgence of tuberculosis in the United States and globally is occurring against a backdrop of concerning trends in public health funding. The current political climate, marked by austerity measures and a shift in priorities, threatens to undermine decades of progress in TB control. Public health departments, already strained by the COVID-19 pandemic, are facing budget cuts that could cripple their ability to respond effectively to TB outbreaks. These funding cuts have real-world consequences. They translate into fewer resources for essential services such as contact tracing, testing, and treatment. They also mean fewer public health workers on the ground to educate communities about TB prevention and to ensure that individuals with latent TB receive the care they need to prevent the disease from becoming active. The erosion of public health infrastructure is a recipe for disaster. It creates a perfect storm for infectious diseases like TB to spread unchecked. A robust and well-funded public health system is essential to protect the health of all citizens. Investing in public health is not just a moral imperative. It is a smart investment. in a healthier and more productive society. Section 7, the importance of early detection. Early detection is paramount in the fight against tuberculosis. The sooner a case is identified, the sooner treatment can begin, breaking the chain of transmission and preventing further spread. However, many cases of TB go undiagnosed, particularly in the early stages when symptoms may be mild or nonspecific. This delay in diagnosis allows the disease to progress and increases the likelihood of transmission to others. Several factors contribute to the challenges of early TB detection. Many people, even in developed countries, lack access to quality health care or face financial barriers to seeking medical attention. Stigma surrounding TB can also prevent individuals from coming forward for testing or disclosing their diagnosis. Furthermore, the symptoms of TB, such as cough, fever, and weight loss, can be easily mistaken for other respiratory illnesses, leading to misdiagnosis and delayed treatment. Public health campaigns play a crucial role in raising awareness about TB and promoting early detection. Educating the public about the signs and symptoms of TB, as well as the importance of seeking medical attention if these symptoms arise, is essential. Encouraging individuals in high-risk groups, such as those experiencing homelessness or those in close contact with TB patients, to get tested regularly is also crucial. Section 8, Treatment and Prevention. Treating tuberculosis is a complex and lengthy process, requiring a combination of antibiotics taken over several months. Adherence to the strict medication regimen is crucial for successful treatment and to prevent the emergence of drug-resistant strains of TB. However, maintaining adherence can be challenging, particularly for individuals facing social and economic barriers. Directly observed therapy, or DOT, is a strategy employed to improve treatment adherence. With DOT, a healthcare worker directly observes the patient taking their medication, ensuring that each dose is taken as prescribed. DOT has been shown to be highly effective in improving treatment outcomes and reducing the risk of drug resistance. Preventing the spread of TB requires a multifaceted approach. This includes identifying and treating individuals with active TB, as well as those with latent TB infection, who are at risk of developing active disease. Other preventive measures include improving ventilation in crowded living spaces, promoting good hygiene practices, and addressing the social determinants of health that contribute to TB vulnerability. Section 9, a call to action. The resurgence of tuberculosis in Kansas City and beyond is a wake-up call, a stark reminder that infectious diseases respect no boundaries and that neglecting public health comes at a steep cost. Addressing this public health crisis requires a collective effort, a commitment from governments, healthcare providers, and individuals to prioritize TB prevention, detection, and treatment. Investing in public health infrastructure is paramount. Strengthening public health departments, providing them with the resources they need to effectively respond to outbreaks, and supporting research into new diagnostics, treatments, and vaccines are all critical steps. Addressing the social determinants of health, such as poverty, homelessness, and lack of access to health care, is equally important. These factors create fertile ground for TB to thrive. We must also combat the stigma surrounding TB, which prevents individuals from seeking testing and treatment and perpetuates the cycle of transmission. Education and awareness campaigns can play a vital role in dispelling myths and promoting understanding of this preventable and treatable disease. The fight against tuberculosis is a marathon, not a sprint. It requires sustained commitment, collaboration, and a willingness to address the root causes of this global health challenge. By working together, we can turn the tide against TB and create a healthier future for all.